Hello everyone, welcome to the channel Kerala Nurses Hub. In this video, we are going to briefly discuss regarding hydrocephalus. The word hydrocephalus comes from two Greek words. Hydro means water and cephalus means head. The definition of hydrocephalus. Hydrocephalus is the pressure-dependent enlargement of the cerebral ventricles due to obstruction in the drainage of the CSF, mainly occurring in infants and elderly. Hydrocephalus affects a wide range of people from infants and older children to young, middle-aged and older adults. For every 1,000 babies born in this country, 1 to 2 will be having hydrocephalus. And hydrocephalus is considered as the most common reason for brain surgeries in children. Let's see the etiology. First one, disorders of CSF production. So this is the rarest form. Choroid plexus papilloma and choroid plexus carcinomas can secrete CSF in excess amount. So, the epithelial cells which is lining the choroid plexus is producing the CSF. Next reason, disorders of CSF circulation. This form result from obstruction of the pathway of CSF circulation which can occur at the ventricles or arachnoid villi. Tumors, hemorrhages, congenital malformations and infection can also cause the obstruction. And the third reason is disorders of CSF absorption. Conditions such as superior vena cava syndrome and sinus thrombosis can interfere with CSF absorption. Let's see the congenital causes. Congenital hydrocephalus is present in the infant prior to birth. The common cause of congenital hydrocephalus is aqueductal stenosis. Aqueductal stenosis occurs when the narrow passage between the third and fourth ventricle is blocked or too narrow to allow the sufficient CSF to drain. This will cause the fluid to accumulate in the upper ventricles, causing hydrocephalus. Next is acquired causes. Hydrocephalus is acquired as a consequence of CNS infections like meningitis, then brain tumors, head trauma, toxoplasmosis or any kind of intracranial hemorrhages. Next, see the pathophysiology. So, normally a delicate balance exists between the rate of formation and absorption of CSF. In hydrocephalus, this balance is disturbed. CSF is formed mainly in the lateral ventricles by the choroid plexus and is absorbed into the venous system through the arachnoid villi. CSF circulates within the ventricles and the subarachnoid spaces. Any obstruction happening in the free circulation of CSF will block, and this will be leading to increased pressure over the brain and spinal cord. And let's see the signs and symptoms. Here I am only briefly explaining the signs and symptoms. Bulging fontanelles, rapid increases in the head circumference, the eyes that will be fixed downward known as sunset eyes, then seizures, vomiting, poor feeding and low muscle tone and strength. And regarding the management, here no medical management work effectively and the child has to undergo the surgical correction. So usually the management we follow is a shunt system. Shunts will be performed in most of the patients. The principle of shunting is to establish a communication between the CSF and the drainage cavity. Ventriculoatrial shunt. A ventriculoatrial shunt is also known as a vascular shunt. It shunts the cerebral ventricles through the jugular vein and superior vena cava to the right atria. It is used when the patient has any abdominal abnormalities where a ventriculoperitoneal shunt cannot be used, and this shunt requires repeated lengthening in a growing child. And let's see the common nursing diagnosis. Ineffective cerebral tissue perfusion related to inadequate production and absorption of CSF as evidenced by altered mental status. Self-care deficit related to inability to move the limbs, altered sensorium secondary to neuronal dysfunction. Anxiety related to the family or caregiver's fear of the surgical outcome. Risk for infection related to the presence of VP shunt or VA shunt. And risk for injury related to increased ICP. Risk for impaired skin integrity related to pressure from physical immobility. Risk for delayed growth and development related to impaired ability to achieve the developmental task, and deficient knowledge related to the family regarding the understanding of the disease condition and home care. So thanks for watching. Please subscribe the channel for more informative videos.